Hello and welcome to another beautiful episode of Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Al-Hassan. You already know on Healthy Living, we talk about everything in relation to your health and well-being. Now, navigating the emotional and psychological landscape of fertility challenges is a complex journey that significantly impacts mental well-being. Individuals and couples grappling with fertility issues often experience a range of emotions, from grief and frustration to hope and resilience. The emotional toll extends to relationships, requiring thoughtful navigation to maintain connection and support. Clinical psychologists play a crucial role in helping individuals develop coping mechanisms, fostering resilience, and addressing the broader mental health implications of fertility challenges. On Healthy Living today, we will explore the aspects of mental well-being in fertility struggles, shedding light on coping strategies, relationship dynamics, and the importance of holistic support with clinical psychologist Abiodun Emmanuel Arogundade. Yeah, welcome to the studio once again.
Good morning. Thank you for having me once again.
How are you doing today?
I'm very well, thank you.
All right. To kick off the conversation, can you give us an insight or an overview of what mental well-being is in context of fertility challenges?
Yes. So we know that infertility is a disease of both male and female reproductive system. Characterized by failure to have a pregnancy after 12 months or more of regular sexual intercourse. And in our society, we believe that having a child means having a fulfilled life. Mm-hmm. So what then could be worse than having a feeling of unfulfilled life because of infertility? So you see, infertility is not just a problem of it's not just a medical problem alone. It affects all areas of life, importantly the mental well-being of the patients in questions. And these individuals or couples faces a lot of psychological problems, such as feeling of guilt, emptiness, and anxiety, depression, and stress. And with stress, at least chronic stress, comes with symptoms like lack of interest in sexual intercourse, sadness, panic attacks, a weak immune system, stomach and digestive problems. So high level of psychological distress have been reviewed to impede infertility treatments. So this is how these things can affect a person's well-being, mental well-being.
You know, talking about high level of psychological distress can actually impede fertility treatments. You know, before now, people used to, whenever they say, do not think about it if you want to get pregnant, it will just come on its own, that the agitation could actually lead to infertility. Is that corroborating with that statement you made?
Yes. So I'm speaking from a clinical psychologist point of view. So we know that, just like I mentioned, these psychological problems, for example, like stress, we know that with stress comes with all various of illnesses. And for example, let's take our digestive systems as an example. When you are stressed, sometimes you realize that you eat and the food you eat is not even staying in your stomach. Sometimes you feel like vomiting. So when all of this is happening in our system, it could be hard to see the fruits of your labor when it comes to fertility. So yes, agitation can affect infertility.
Talking about this, you know, people often say there are lots of emotional ups and downs, back and forth. Could you please explain some of these emotional distress that people go through so that viewers at home can actually understand and maybe get to, in case they are in that situation, they get to relate better with it?
Okay, so the individuals or couples, these individuals or couples faces a lot of challenges. For example, emotional distress, communication breakdown, and lack of intimacy. you know, and all these things. In order for them to be able to navigate all these challenges, we often advise they practice effective communication, mutual support, and of course, sometimes seek professional assistance.
Okay, so in this case, you said some of them actually go to you. You always advise mutual support from the couple, right? So what about the society? Because sometimes the people that actually make it tougher for couples who go through fertility challenges are sometimes the people from their immediate environment. So what do they do in such situations?
Do you mean the patients or the family supports?
The patients now, because we're looking at their own mental well-being, first of all. They are our priority today, so.
Okay. So you see, we faces a lot of challenges in life that we did not bargain for. Understand, and we understand that these are the things that are out of our control. So how they can deal with this is try to build a mental resilience. And how can they build mental resilience is by seeking for professional assistance. They should try and set realistic expectations. You know, with realistic expectations, there's less disappointment. And create a support group in the sense that your family are your number one primary support group. We always say that. Your friends. And surround yourself with people that have faced these challenges before. So when you speak to them, or if they want to speak to you, they will be speaking from a place of empathy. So they know how to talk to you, they know how to advise you in order not to exacerbate the stress you're already undergoing. Yeah.
Okay, so as a clinical psychologist, I'm sure you've had to, meet with some of these people and talk to them, try to counsel them. Could you please share maybe with us a few life experiences that you've had and how you actually advise them to deal with it?
Okay. So we often, see couples complain of losing their once satisfying sexual life once this treatment begins. And emotional distress and demands of treatment can influence the frequency and quality of sexual life. And this becomes a problem, at least with couples that are trying to get children. And when they complain about losing their sexual life, in fact, there's something called sex on demand. It simply means scheduled time for sex. Just imagine a once pleasurable experience turned to a task to be achieved. So in this case, we often advise these couples to try and practice open dialogue about their intimate time. They should try and schedule non-fertility related intimate time. It will help with their emotional bonding. So we also try to equip them with communication strategies and coping strategies.
Okay. Would that be all you do for them? So what about the society at large that majorly impacts some of these things that happens to them emotionally?
Can you retrace the question?
I said, what about the society that actually impacts some of these things that happen to them emotionally? Because there's always this stigma around the couple. Once you're married, first of all, it's expected that in the next 9 months, in fact, on your wedding day, they're already giving it to you as a psyche. Just like you were saying the other time, the last time we had an interview, you said for a little boy, they'll probably be telling him, you cannot break down. You're a man, you're strong. That's the same way they already start giving couples on their wedding nights. In fact, at the wedding venue, like in the next 9 months, so we are coming to eat rice, we are coming to carry baby, we are coming to do omungo, those kind of lines, they start chopping them. And the woman already, it's building up in her psyche, the same way for the man. And then the next thing they are thinking of is, when do I get pregnant? When do I get pregnant? Some people would even reach out to you to call you on the phone like, how far are you already pregnant? And people start looking at your stomach like they call them the womb watchers. You know, in this kind of situation, how should couples handle these external forces that impact their mental well-being?
Again, it's just like I've said before, it's simply building a mental resilience. You can't control what people will say to you. And like I mentioned earlier, how do you build mental resilience? For example, I said, practice compassion. You understand? Be compassionate towards yourself. And tell yourself the things you would tell a friend that's in your shoes. What advice would you give? How would you treat someone that is in your shoe? So when you show yourself enough compassion and understand that there are things that are out of your control, you wouldn't be bothered much. Understand? And emotional intelligence is very, very important. There's nothing you can do to control what people will say to you. Like you mentioned, the womb watchers, you know, it's a very terrible thing in our society. In fact, recently I saw an actress, Tonya Aimaku, on Instagram on a show like this, and she was talking about these related issues, and she was talking about how people would come onto her, even amidst a lot of people, and started asking her questions like, how would you, when are we seeing a junior brother for your child or a junior sister for your child? Understand? People will go under a comment section and tell her, you know, your friend has another baby, what are you waiting for? Your child is already grown. So how do you deal with people? Or how do you stop people from saying those things to you? You can't. For example, on social media, when someone is trolling you, they keep telling you, block them. But can you block?
And they can troll you with several things.
Yes, but can you block everyone that trolls you? When you block one person that trolls you, millions of them rises up. You understand now? So what you can do with yourself is the priority, which is to build mental resilience, like I said.
Okay, but let's look at the impacts that these fertility challenges can have on the relationship between the couple and the families, the dynamics at home. What are the dynamics that can begin to play out because of these emotions that have built up?
So one of the, I think I mentioned earlier, one of the dynamics is lack of intimacy. You understand now? Like I mentioned earlier, emotional distress causes these things to happen in a relationship. And when it comes to family, isolation comes into play. You know, one of the difficult things for couples or individuals undergoing infertility treatment or contemplating on having one is how they are going to explain or tell their family or friends what they're about to embark on. It's a very big challenge for these people. And this kind of stress can cause isolation. So this isolation is based on the perceived feeling of stigma. What are they going to say? Would they understand where I'm coming from? Understand now? So what do? They start to withdraw from their families and friends. They stop going to places they once usually go to have fun because they believe there's one or two people there that will be looking at them. You understand? If they eat too much and their stomach is swollen, they will say, oh, I'm the first to see it, or, you know, we are expecting, stuff like that. And these kind of things causes them to stop going out to places they usually go to enjoy. And it can also break down communications between couples because we know that individuals deal with emotions differently. And sometimes these couples or these individuals, they don't speak to their partner about their own personal feelings. You understand? About their own personal emotions. So there's two things here now. Individual emotional feelings and couples' feelings. They can experience these feelings together, But personally, they have their own feelings to deal with as well. So if they don't engage each other in this conversation, it can cause a breakdown in communication within the couples.
Okay, so that means that's like leading us into some of the coping strategies, which is first of all communication. So what are the other coping strategies that someone who's not so used to the topic of mental well-being? Of course, we already know that talking about mental well-being and mental health is something that we still need far-reaching audience. We still need to reach out more to tell people about. Some people don't even believe anything called mental health. I think I was talking to somebody and I was like, okay, and I was engaging in a conversation with somebody and I said, this child's mental health is at stake. And somebody was like, you people should stop all those bullshit about mental health or no mental health. Stop this thing. There was never mental health in the first place with our parents, our aged parents. You know, people just find it absurd. Some traditional people find it very absurd to talk about mental health. So for someone who's not so used to the phrase mental health or mental well-being, what are the coping strategies that they can use when they find themselves in this kind of situation?
Okay, so first of all, what we advise is if you are anticipating to go for the fertility treatment, or if you are already going through this treatment, we advise that you seek for therapy. So ideally, it's advised that before you even begin this journey, you should seek for therapy. So we advise these couples to practice open and honest communication. So when you are having an honest dialogue about this fertility treatment, you'll be able to create a safe space where you can express your fears, your worries, and your expectation without the fear of being judged. You understand? We also teach active listening. You understand? When you're having a conversation with your partner, try to show them that you are present. You understand? When they are speaking to you, pay attention. Look into their eyes and try to rephrase their statement back to them so that you can ensure that you are getting the right thing they are saying, and they can be assured as well that you are listening to what they have to say. We also have what we call established communication time. It's communication time. So this is a time you set aside in a day or a day in a week where you speak about this infertility treatment. So what this will do for you, it will help you to be able to communicate on other topics that usually both enjoy discussing. You understand? So that every of your conversation will not be centered around infertility. Understand? Because when this happens, it causes emotional disconnection. Understand? And seek support. I mean, professional support in this case. At least when you come to our space, we can help you navigate these emotions. And of course, when couples come to us for help in this manner, we often see that, in our society, we already know how difficult it is for men to open up about their emotions. So when they are in a safe space, like in a therapy session, they will be able to express themselves, and they can tell us their worries, their concern, and we can be able to, manage them better.
All right, you talked about support network. So what happens to someone who doesn't have that support network? How do they navigate fertility challenges and their mental well-being?
Okay. Is there anyone that doesn't really have a support network?
Hey, I know of some of them. Okay, so I'll tell you a brief story and why I said support network. So there's this lady who's been having fertility challenges for a while. She's like the second wife of the husband. And then the husband had children in his first marriage and he doesn't care. so to say. And she's been struggling to have kids for, say, 2-3 years now. So it's been a matter of families come and say, you still don't have children. Husband will be like, you have children will come, or it's not me, I'm not the problem, it's you. And then she goes to the clinic every now and then, checks herself, she's fine. And then she'll be like, can you come and check yourself? He'll be like, what do I need to check myself? Or I had kids in my first marriage. It's up to you, so it's you. So it's not even in that place with her. It's not even in that conversation with her. And that kind of person doesn't get support from family, husband. So that's why I'm saying, for somebody who doesn't have this kind of support network, what can they do?
Okay. In fact, what you just described now actually brought back a memory, if you would permit me to share.
Absolutely.
So while growing up, I think, through my secondary school year, my maternal grandmother, Mrs. Ojolakwe, may also continue to rest in peace.
Amen.
She's very vast in herbal medicine. You understand? She has this wealth of knowledge when it comes to herbs and roots. So then...
Okay, I'm afraid I want you to share that story, but let's quickly go on a break when we return so that you can share that story and viewers can stay glued. At least they'll have a reason to come back and still dial in. All right, viewers, I'm sure you're enjoying the conversation. And psychologist Abiodun has a story to share with you. You don't want to touch the dial. Welcome back. You're still watching Healthy Living, and we're navigating through challenges of fertility with psychologist Abiodun Arogundade Emmanuel. All right, before we went on the break, you were trying to share a story with us about your maternal grandmother. So please shoot.
Okay, so I said that she's a person that has this wealth of knowledge when it comes to herbs and roots, so especially when it comes to women issues. And people would travel far and wide. I mean, you see people come from Port Harcourt, from Abuja, Lagos, so very far away places to a remote town in Ekiti State. And these women, they would come, usually they come, I don't know if she purposely asked them to come during that period, like when there's heat, so that they could just lay their mat outside and everybody will sleep outside, because sometimes these women, they spend like 3 days a week, eating what is prepared. Some sort of
camping.
Yeah, so eating what is prepared for them, drinking, bathing, and all of that. But what I'm trying to lay emphasis on is 95% of these women come alone. 95%. In fact, out of the remaining 5%, maybe few comes with their driver, and for that period of time, they will stay alone. So my grandmother would always ask them, so where's your husband? There are things you are supposed to do together. There's one particular woman that our story just won't go away, Our story is stuck. She said they've abandoned her. I mean, abandon you. She said even her own family abandoned her. So now our husband is just expecting her to go and bring a child.
Bring a child.
So how do this person cope? Unfortunately, number one thing to do is to educate yourself. Understand now? When you educate yourself, when you understand what you are dealing with, you will know the resources that are at your disposal. First of all, seek for professional help. They are your number one friend. I'm talking in terms of medical and in terms of mental health practitioners. Understand? When you educate yourself, you understand what you are dealing with, then you will know where to go to. You will know who to surround yourself with. You understand? I mentioned earlier that you can find a support group, like people that have experienced the challenges you are going through. When you connect with that kind of people, they know how to empathize. And what another thing you can do is to practice relaxation techniques, like mindfulness, like meditation, yoga, like deep breathing. These things have been said to decrease stress and, of course, help with overall mental health. So, unfortunately, there's not much you can do when you don't have these support systems we're talking about.
So let's look at balancing the medical aspects and the emotional aspects. How possible is it for somebody to strike a balance between them, the medical aspect of having to deal with fertility issues and then the emotional aspect? Because I'm sure they're going for treatments, they're doing back and forth, just like the description you gave now of how your maternal grandmother would have them come around. You know, at that point when they are camping, there's always so much expectation and agitations and prayers of, God, please let this work for me. So how do they get to balance all of that? And I believe, like you said, that sometimes the emotional, the imbalance emotionally could actually impede the fertility. So how do they get to strike a balance between these two aspects?
So unfortunately, we know for a fact that people going through infertility procedure, only 50% of patients will become a parent.
Only 50%?
Yes, will actually become a parent.
Do you think the remaining 50% is due to the fact that they have it up there?
I don't know, honestly.
Okay.
So, like I said, I'm not a medical practitioner, so
course.
I can't speak authoritatively on that. But of course, studies have shown us that when we deal with psychological problems relating to infertility, it can increase the chances of having a good result. So how do they strike a balance? So I was saying that we know that it's only 50%. So imagine not knowing if you are among the lucky 50%. That could cause a lot of stress. How to strike a balance is just to work with your practitioners. You understand? They know how to handle you better. Number one thing to have at the back of your mind once you step in to take this treatment is to realize that you are no longer alone. Even as we were speaking earlier, that even if you have no support system, realize that you are not alone anymore. And when you look at the rooms of your clinicians, you will see men and women standing by you compassionately. So you can tap in from their encouragements.
Okay, so in the case where somebody feels a little overwhelmed about the situation that they're going through, how can they seek help? What steps can they take?
When they become overwhelmed.
As most people actually are.
Yes, because uncertainty and loss of control can cause one to become overwhelmed. And it's okay to pause, it's okay to take a break. I'm not saying take a break from the medication you have been given or stop going to treatment. No, I'm just saying it's okay to take a break mentally, to tell yourself that technically you don't have much control over these things, and just practice relaxation techniques like I've said earlier, because when one is overwhelmed, they probably, it's either they are sad and they don't even have the strength to seek for the required help. Again, this is where family support or support system comes in. So if you don't have a support system to root for you when you are down, to lift you up, stay connected to your clinicians. And of course, we as a psychology, we know how to help deal with this situation. When there is a mental burnout, we know how to deal with such a person.
You know, talking about this mental burnout, it reminds me of a couple of persons that I know that most of the time they just tell you, I'm overwhelmed. They'll tell you having children is not the ticket to getting into heaven. Some of them will tell you that. And when you tell some of them that, I think you need to seek professional help, they'll tell you, no, I'm absolutely fine. I'm good. I am all smiley and I'm all shades of glowing. But deep down, they are not fine. Most of them live in denial. How do you cope with some of these kind of patients?
Okay, so decisions to seek for help, there are emotional aspects to it. In fact, the fear of loss, you know, and it can contribute to how these people make decisions to go for this treatment. For example, it can be a motivating factor even because of what society is saying. Those negative things they are saying to them could even, even help them to seek for help. Another thing with decision making when it comes to infertility treatment is finance. So those people you are saying that, they said they are fine, this and that. We know it could be financial problem. We know these treatments are expensive. So finance play a very significant role in seeking for fertility treatment. Also, we have personal values and beliefs. Personal values and beliefs, both cultural and religious. Understand, they play a very big role in decision making when it comes to infertility treatment.
Okay, earlier you had talked about communication, proper communication between couples. And are there specific communication strategies that you can actually share, that would help them? Because I'm sure they are currently watching. So are there specific communication strategies that you can share that will help them understand better? I think there was a particular time I was listening to a woman speak, and then she was talking about some languages to use in marriage. You no longer say I, you say ours. You no longer make it a personal thing, you make it a group thing, like us. It's no longer I, it's us now, and all of that. So are there specific languages and communication strategies that can be used for effective communication, to help ease the burden on the mental well-being?
All right, so, we naturally, when you get married to someone, you become one, even though you can still be yourself, but you become one. And this language, as this I statement, begins to change naturally. When you have a healthy marriage, naturally this language is changed to we, us, and of course we often advise to use these languages often. And like I said earlier, just practice open and honest communication, and in order to do that is, like I said, create a safe space where you can both express your feelings. When you know that you can talk to your partner without the fear of being judged, you understand, it makes it easier whenever you feel down to tell your partner, this is what I'm going through. You understand? And another thing in communication is, try to respect each other's coping styles. So, for example, one partner might be open to talk freely about their infertility treatment, while the other might need some time to talk about these things. just respect each other's opinion and try to find a balance that works for both of you.
Okay, you just mentioned that coping mechanisms can have types. Because you said you just have to respect your partner's coping mechanism. Does it mean that they have types?
Yes, like I said, individual deals with emotions differently. You understand now? Even though you can deal with these things as a couple, but personally, you might have the way you want to deal with these emotions. You understand? For example, your spouse coping mechanism might be listening to music. You understand now? And if you don't understand that this is his coping mechanism, you might begin to ask, what is making you listen to music? Is this the time to be listening to music? We are going through so much. We are going through this, we are going through that, but all you want to do is to sit down and enjoy good music. You understand? So when there's differences in this coping mechanism, it could cause a clash. So when you understand how your partner copes better, and this is one of the things we do to help individuals identify their own coping mechanism. You understand now? So when we present it to the tables, in fact, you know, when we have couple session, we often ask them to talk to each other. You understand now? Or when we ask questions like, what are the best things you know about your husband, or what are the best things you know about your wife? You understand now? Through this conversation, they tend to realize that there are some things they don't even realize. So when they are done talking, we ask, what is the percentage? How would you score what she said? Or how would you score what he said? You understand? You see some couple, she got it at least 50%. So, oh, okay, she tried 70%. Oh, she tried 90%. Oh, she knows me, or he knows me 100%. You understand? So when they understand these things, it will help to foster communications better.
All right, so beyond immediate emotional response from couples who are waiting, what other impacts can, you know, this infertility have on their mental health, and what signs should we be on the lookout for?
So let's look at something like self-esteem. You understand? Okay. And so when the issue of self-esteem comes in, so we have social comparison, for example. So let's say a woman goes out, or a couple, they went to visit a friend, or they are in a gathering, and they see a friend with their kids, 2 or 3 kids running around. Even worse, if they were married before the said friends, what do? They start to compare themselves to this other couple. And when this happens, it can create the sense of I'm a failure. You understand? So when these things is happening, these couples tend to internalize infertility problems as a personal failure. But what we usually try to remind them is that infertility problems are complex and they are multifactorial. So they need to understand that it's not their fault, so stop blaming yourself. So when they understand this, it can help them deal with their self-esteem. When you understand that you did not cause this to yourself. And this issue does not represent your overall worth. You understand?
Absolutely. So is it just self-esteem that could be the challenges that some of them could have?
You know, like I've mentioned, a lot of couples of psychological problems they could have, like depression, anxiety, and all of that. So it's not just only about self-esteem. Yeah, so there are various like that. It can cause sense of guilt, you know.
Okay, so are there aspects of this conversation that we have not touched that you would like to touch on?
Well, honestly, I think we've covered as much, but what I would advise is, if you are, now this is an advice to the couples.
Great.
So if you are contemplating or already into the procedure, please importantly seek for counseling. You understand? It helps to create a very safe space to express your emotion. Then the second thing is, to families and friends out there, please respect people that are going through this fertility treatment. Respect their privacy, you know. Don't ask questions. Don't ask unsolicited questions. Understand now? Sometimes these people, they just need someone to listen to them. Be empathetic. The emotional stress they are going through alone is enough.
Some people are just insensitive.
You
Even
know?
body languages and all that. speaks.
Exactly. So please just be empathetic and respect their space. And you know, people might decide to take different routes. You understand? Like, for example, they might decide to go for adoption. They might decide to go for surrogacy. In fact, there are people that want to live child-free.
Mm-hmm.
You understand? So you going to them asking them these questions is totally out of place. So I think that would sum it all up.
All right. Thank you very much, Psychologist Abiodun Emmanuel Arogundade. I really appreciate you for your time today.
Thank you very much for having me.
Thank you so much.
Thank you.
All right, viewers, we've heard from our guests today. We must all learn to live our lives devoid of people's opinions. And dear people, please learn to reduce the uncomfortable questions you ask people in waiting for the betterment of all of us. Thank you, and that's where we draw the curtains on today's episode of Healthy Living. I am Olamide Al-Hassan, and I'll see you again next week. Bye.